Everyone, today we will be talking about biomechanics of temporomandibular joint. Mandibular joint is extremely complex joint because what happens, the condyles are bilaterally attached to cranium through mandibular fossa, correct? And movement wise this structure can be divided into two systems. So the first system is the condyle disc complex which is formed, that is the inferior synovial cavity, condyle and articular disc together form condyle disc complex. Now what happens is this articular disc is basically tightly attached with the condyle because of medial and lateral discal ligaments. So the only physiologic movement that is possible at this surface, at the condylar surface, is rotation. Okay, so if you have noticed that you open your mouth slightly and the condyle only rotates at a fixed point. Okay, so that is the first system. Now the second system is that this condyle disc complex is against the surface of mandibular fossa. Okay, so that what happens there is in the mandibular fossa, the condyle is not tightly attached. So there are free movements which are possible. So free sliding movements occur in this surface, in the superior cavity. Got it? And there the mandible moves forward, and that is translation movements that occur between superior surface of articular disc and mandibular fossa. So in this what happens is the width of the articular disc space varies with interarticular pressure. Okay, so when the pressure is low, that is closed rest position, disc space widens, and when the pressure is high, that is clenching of teeth is occurring, the disc space narrows. Since anterior and posterior bands are thicker when compared to the center zone, what happens is the disc can rotate anteriorly or posteriorly to accomplish this task. Now what happens during mandibular opening? The condyle is pulled forward down the articular eminence. The superior retrodiscal lamina becomes increasingly stretched, creating increased forces to retract the disc. The interarticular pressure and morphology of disc prevents the disc from being overtracted posteriorly. Okay, superior retrodiscal lamina is the only structure which is capable of retracting the disc posteriorly on the condyle. The anterior border of the articular disc is attached to superior lateral pterygoid. Thus, it constantly maintains a mild state of contraction, exerts slight anterior and medial force on the disc. In resting closed joint position, thus the anterior and medial force will normally exceed that of non-stretched superior discal lamina. The disc relationship is maintained during minor passive rotational and translatory mandibular movements. As condyle moves more forward, superior retrodiscal lamina gets stretched. Greater force than the superior lateral pterygoid muscles are applied. This allows the disc to be rotated posteriorly to extent permitted by the width of articular disc space. Of TMJ. So basically it provides smooth, efficient movement of mandible during mastication, swallowing and speech, provides stability of mandibular position and prevent dislocation from external forces, and provides sensory input to activate protective neuromuscular reflex. Thank you. Please share, like and subscribe.